Hello, Dr. Goodwin.
Good morning. How are you?
I'm fine, thank you.
Good. I'm pleased to be talking with you this morning about fractures and the importance of understanding our fractures.
I'm very happy to be here.
Right. Okay. That's very good. As you know, fractures are a major issue for health care, especially osteoporosis. So can you tell me something about osteoporosis and why it's so important?
I'd be happy to talk about osteoporosis and why it's so important. Osteoporosis is a chronic progressive disease that causes weakening of bones. That can happen either because too much bone is lost, too little bone is formed, or a combination of both. Over time, bones become thinner and more brittle and more likely to break. There are 10 million Americans with osteoporosis, and a fracture related to osteoporosis happens every 20 seconds in this country. As we know, and as you mentioned, fractures can be life-changing events. So it's very important for us to recognize osteoporosis and to recognize fractures and try to do everything we can to prevent them.
And what can be done to decrease the probability of osteoporosis?
One of the things that we can do to decrease the probability is to be aware of our risk factors and talk to our healthcare providers about potential risk factors and whether or not we need a bone density test. When we think of risk factors that increase the risk for broken bones and osteoporosis, those are things like age, family history or genetics, especially the history of a hip fracture in mom or dad, being low body weight or thin and having smaller bones, and having had a prior fracture, because once you've had a first fracture, that doubles your risk for having another fracture. And then there are lifestyle factors like smoking and excessive alcohol, and those are things which we can modify.
Okay, and what would you say is the most important thing to do to decrease fractures?
I think we need to think about preventive measures. So having a well-balanced, healthy diet, making sure that we're getting in adequate calcium and vitamin D, weight-bearing, muscle-strengthening exercise is good, and avoiding the risk for falls, because a fall is often the precipitating event for a fracture or broken bone.
Okay. Now, what is World Osteoporosis Day?
World Osteoporosis Day, which is October 20th, is a day that's really meant to raise awareness for osteoporosis and fractures, the importance of prevention as well as recognition and treatment, and provide people with information so that they can be proactive and take care of themselves by asking their healthcare providers about their risk and whether or not they should have a bone density test.
Okay, and I understand that certain focus is on Georgetown University Hospital in terms of osteoporosis.
Well, I practice at MedStar Georgetown University Hospital in Washington, D.C., where we have a bone density program, and we encourage people to speak with their healthcare providers and then come see us as necessary. There are many centers throughout the country and individual healthcare providers who can work with their patients to provide this information, assess risk, and make sure that patients are well taken care of.
Okay, and what about women having osteoporosis? Is that more probable than with men?
Osteoporosis is more prevalent or more common in women, but it can affect both genders. So both men and women are at risk. People of all races are at risk. So it's very important that each individual be proactive in assessing his or her own health and risk factors. Okay, so nothing makes you safe from osteoporosis and the potential to have issues in the future.
I see. Well, this was certainly useful information for my Health Power audience, and I'm very pleased that you're providing this information for our Health Power audience.
Well, I'm very happy to do so. Thanks for having me.
Okay, so long.